effects of the ketogenic metabolic therapy on patients with breast cancer, a randomized controlled clinical trial. I am Dr. Khodabakhshi, PhD of Clinical Nutrition and faculty member of Kerman University of Medical Sciences from Iran. And this presentation includes introduction, methods, results, and the discussion. Introduction. Cancer cells are highly dependent on the glycolysis, even in the presence of sufficient oxygen. Ketogenic diets reduce the glucose needed to drive the Warburg effect, while also elevating ketone bodies. Ketogenic diet is emerging as a novel complementary or alternative therapeutic strategy for a broad range of malignant cancer, including breast cancer. And ketogenic diet reduce cellular proliferation, inhibit tumor growth, and have anti-angiogenic, anti-inflammatory, and pro-apoptotic properties. The objective of this study was to examine the effects of 12 weeks of ketogenic diet treatment on the response rate, tumor marker, inflammatory and anti-inflammatory markers, and growth factor in patients with locally advanced and metastatic breast cancer. Methods. This study is a randomized controlled clinical trial. We included the locally advanced and metastatic breast cancer patients from a medical oncology clinic from a Shahadat Tajri. Excuse me, I think the slide is mixed and uploaded again. A slide. I think a slide is mixed. I excuse me. Excuse me. 80 patients randomly assigned to the intervention group or control group, 40 patients in the ketogenic diet group and 40 patients in the control group. Inclusion criteria were locally advanced and metastatic breast cancer patients between the age of 80 to 70, and the patients were undergoing chemotherapy for at least 12 weeks. Exclusion criteria were significant cardiac, renal, or neurologic comorbidity or with malnutrition, diabetes, pregnancy, or Carnifex index less than 70. Intervention duration was 12 weeks. Uh, we prescribed a ketogenic diet for patients in the intervention group. This diet comprised of 75% from fat, 19% from protein, and 6% from carbohydrate. We asked patients in the control group to follow a standard diet. This diet comprised of 55% from carbohydrate, 15% from protein, and 30% from fat. We assessed body composition, dietary intake, physical activity, quality of life, biochemical measurement, and finally, we assessed the response rate. Lipid profile, insulin, IGF-1, tumor marker, interleukin-10, TNF-alpha were measured at the beginning, middle, and the end of the study. Fasting serum ketone and glucose were measured at the baseline and every 3 weeks and the end of the study. Results. At the baseline, there was not any significant difference between the two groups about cancer type, age, ER, PR, HER2, Ki365, and the stage. But at the end of the study, weight, BMI, fat mass, FBS reduced significantly in the ketogenic diet group compared to the control group. Lactate and alkaline phosphatase reduced significantly in the ketogenic diet group compared to the control group. About lipid profile, cholesterol increased significantly in the ketogenic diet group compared to the control group. Triglyceride decreased significantly in the ketogenic group compared to the control group. TNF-alpha decreased significantly in the ketogenic diet group compared to the control group, but interleukin-10, that is an anti-inflammatory factor, increased significantly in the ketogenic diet group compared to the control group. Insulin reduced significantly in the ketogenic diet group compared to the control group, but this difference about IGF-1 was not significant. Tumor marker had not any significant difference between the two groups. Response rate was a primary endpoint. Reduction of tumor size in the ketogenic diet group was 2017 millimeter, but reduction of tumor size in the control group was 6 millimeter. That this difference was significant. Survival rate was higher in the ketogenic diet group compared to the control group in locally advanced breast cancer patients. Discussion and ketogenic diet caused a decrease in FBS and increase in blood ketone levels. Ketone bodies inhibited glycolysis, which in turn decreased the main energy production pathway for cancer cells. Decreased FBS result to decrease in glycolysis, decrease in lactate, and decrease acidity of the tumor microenvironment, and finally decrease metastasis. In the present study, there was a significant decrease trend in body weight, BMI, and body fat in intervention group. Ketogenic diet induced weight loss in breast cancer patients and also make them prone to response to chemotherapy. Fasting insulin level were lower in the ketogenic diet group than in the control group. The trend for IGF-1 in the ketogenic diet group showed a significant decrease compared to the baseline. However, this trend was not observed in the control group. In line with our finding, Cohen et al. Shown Fasting insulin was lower in the ketogenic diet group than in the control group, but level of IGF-1 were not significantly different between the two groups. Clement et al. Shown no significant difference between baseline and the end of the insulin and IGF-1 level. Ketogenic diet reduced PI3 kinase AKT-mTOR pathway and downregulate PI3 kinase AKT FOXO pathway and downregulate PI3 kinase AKT beta-catenin pathway. This pathway are expressed in cancer cells. Higher level of insulin and IGF-1 may predict a higher risk of recurrence and mortality in breast cancer. Interleukin-10 was higher while TNF-alpha were lower in the ketogenic diet group than in the control group. No significant difference were found between the group in ESR and CRP. Interleukin-10 exhibits an anti-tumor effect by suppression of NF-kappa B, downregulation of angiogenesis, activation of CTLS factor, and activation of natural killer factors. Lower interleukin-10 expression associated with recurrence, metastasis, and poor survival. Ketogenic diet activate PPR gamma and finally suppress TNF alpha. About tumor marker, after the intervention period, no significant difference were seen in tumor marker between the two groups.